Starting with the name of Allah, who is the most merciful and the most beneficent. Assalamu alaikum. Welcome to my YouTube channel, The Smile Squad. Today we will learn about the topic development of teeth. Development of teeth is also called odontogenesis. Tooth development starts in the 6th week of intrauterine life and continues into adolescence. It's a complex interaction between the oral epithelium, ectoderm, and ectomesenchyme derived from the neural crest cells. Key stages of tooth development. There are 3 main stages. First is initiation, second is morphodifferentiation, and the third is histodifferentiation. First stage is initiation. The formation of the dental lamina, a band of epithelial cells that marks the beginning of the tooth development. Second stage is morphodifferentiation. The dental lamina proliferates and differentiates into various cell types, including amyloblasts, odontoblasts, and cementoblasts. Third stage is histodifferentiation. The cells differentiate and produce the various tissues that make up the tooth, including enamel, dentine, and cementum. Development of dental organs. Dental lamina and bud stage. Initiation and proliferation. Dental lamina formation. Around the 6th week in intrauterine life, a thickened band of oral epithelium forms along the future dental arches. This is the dental lamina, and it gives rise to 20 localized epithelial thickenings called the tooth buds, one for each primary tooth. Bud stage. Each epithelial thickening grows downwards into the ectomesenchyme. These epithelial invaginations become the tooth buds, the earliest signs of the developing tooth. This stage is marked by proliferation, but there is no clear structural shape yet. Clinical relevance. Hypodontia, missing teeth, or supernumerary teeth may result from disturbances in this stage. Stage 2 is the cap stage. It includes proliferation and early morphogenesis. By 8th to 9th week of intrauterine life, the bud enlarges and forms a shallow cap-like shape over the condensed mesenchymal cells, dental papilla. 3 key component forms. Enamel organ formed from epithelium, future enamel. Dental papilla from ectomesenchyme forms dentine and pulp. Dental follicle or sac forms cementum, periodontal ligament, and alveolar bone. Clinical relevance. The shape of the enamel organ influences the type of the tooth, incisors or molars, etc. Early signs of tooth crown shape appear here. The third stage is the bell stage. It includes histodifferentiation and advanced morphogenesis. It occurs during the 11th to 14th week of intrauterine life. Enamel organ differentiates into 4 layers: inner enamel epithelium, outer enamel epithelium, stellate reticulum, and stratum intermediatum. Inner enamel epithelium differentiates into ameloblasts, which are enamel producing cells. Outer enamel epithelium, it is the protective barrier. Stellate reticulum, these are the loosely arranged cells that cushion and support ameloblasts. Stratum intermediatum, it works with ameloblasts to form enamel. Dental papilla differentiates into odontoblast, which form the dentine, and central cells, which form the pulp. Crown shape finalized. The future outline of the tooth crown is fully formed. Clinical relevance. Amelogenesis imperfecta, defect in enamel formation. Dentinogenesis imperfecta, defect in dentine formation. Stage 4 is the root development. Root development includes cervical lobe and Hertwig's epithelial root sheath. Root formation begins after the crown formation is complete. Steps in the root formation. Cervical loop. It is the junction of inner enamel epithelium and outer enamel epithelium. Grows downwards to form Hertwig's epithelial root sheath. Hertwig's epithelial root sheath determines the root length, shape, and number. Inner cells of dental papilla adjacent to the Hertwig's and epithelial root sheath becomes odontoblasts and start forming root dentine. Hertwig's epithelial root sheath disintegrates the mesenchymal cells from the dental follicle contact root dentine and differentiates into cementoblasts, which form the cementum. The periodontal ligament and alveolar bone form around the root. Clinical relevance. Remnants of Hertwig's epithelial root sheath is called epithelial rests of molasses, which can cause cysts. Chronology of tooth development. Deciduous or primary dentition. It starts in the 6th week of intrauterine life. Calcification begins around 14th to 18th week of intrauterine life. Crowns complete by 11 months postnatal. Eruption 6 months to 2.5 years. Root completion 1 to 1.5 years after eruption. Succedaneous teeth, those teeth which replace the primary teeth. It includes the permanent incisors, canines and premolars. Starts developing around birth to 1 year. Eruption is from 6 to 12 years and located lingually or beneath the roots of primary teeth. Non-succedaneous permanent teeth. It includes permanent molars, first, second and third. Do not replace any primary teeth. First molars start calcifying at birth and erupt at 6 years. Second molars approximately 2.5 to 3 years and third molars approximately 8 to 10 years. It is highly variable. Tooth eruption. There are two forms of eruption. First is active eruption. The second is passive eruption. Active eruption when the tooth moves from its bony crypt into the oral cavity to reach functional position. Factors include are root elongation, bone remodeling, periodontal traction, and pulpal pressure. Passive eruption is seen in adults. Gingival recession exposes more of the crown with age, not true eruption but gives the appearance of longer teeth. Deciduous eruption pattern. Mnemonic. Lower before upper, front to back, except canines. Central incisors 6 to 10 months, mandibular to maxillary. Lateral incisors 9 to 13 months. First molars 13 to 19 months, canines 16 to 22 months, erupt after first molars. Second molars 23 to 33 months. Root completion. Each tooth completes root formation approximately 1 to 2 years after eruption, needed for support and stability of the tooth. Position of developing the permanent teeth. Anterior permanent teeth develop lingual to their primary predecessors. Posterior permanent teeth develop in a vertical alignment beneath the primary molars. Malposition can result in impaction, ectopic eruption, and crowding. Late deciduous stage and the role of the permanent first molars. By approximately 5 years of age, growth of the mandible and maxilla has created more spaces for the permanent teeth, which are soon to erupt. These extra spaces often result in the creation of diastemas, or spaces between adjacent teeth, usually in the anterior segment of the arches. Another suggested cause for the diastemas at this stage of development is the pressure exerted from the lingual by developing permanent anterior teeth. The greater space in the arches also allows room for the entry of the first molars distal to the deciduous dentition. The mandibular first molar is normally the first permanent tooth to emerge at about age 6, thus ending the deciduous dentition stage and initiating the mixed dentition stage. The maxillary first molars follow shortly thereafter, and the 4 first molars are considered to be the cornerstones in the development of occlusion of the permanent dentition because they erupt first and because of their strategic location in the arches. The relationship of the maxillary and mandibular first molars to each other has a significant influence on the occlusion of the permanent dentition. In addition, they serve as the guide for the eruption of the other permanent teeth, particularly the other molars. If any of the deciduous teeth are lost prematurely, the permanent first molars in that quadrant has a tendency to tilt or drift mesially. thus reducing the space available for the permanent canines and premolars. This condition changes the first molar's relationship with its antagonist and may result in impaction of the permanent teeth or crowding and malocclusion of the permanent dental mechanism. Resorption. As the permanent teeth erupt, pressure on the roots of primary teeth causes resorption. Odontoclast removes the root structure, allows teeth to loosen and exfoliate naturally. Exfoliation occurs as a result of root resorption and the loss of periodontal support. Deciduous teeth are shed between 6 to 12 years, replaced by the permanent successors. Incomplete resorption. In some cases, the root resorption is partial or irregular, which results in delayed exfoliation, misalignment, or impaction of the permanent teeth. Double row of teeth, especially in interiors. Ankylosis. Fusion of cementum or dentine directly to alveolar bone with loss of periodontal ligament. Tooth becomes stuck in bone and does not erupt with the rest. It leads to infraocclusion, tipping or drifting of adjacent teeth, interference with eruption of successors. Permanent eruption pattern, mnemonic 6, 1, 2, 4, 5, 3, 7 and 8. It refers to the FDI tooth numbers. First molars 6 years, central incisors 6 to 7 years, lateral incisors 7 to 9 years, first molars 10 to 11 years, second premolars 10 to 12 years, canines 11 to 12 years, second molars 12 years and third molars 17 to 21 years.